Welcome to another video from Lifestyle RX. As a medical doctor working in the field of rehabilitation medicine, I have for the last 10 years seen fibromyalgia patients on an almost daily basis. I have seen firsthand how debilitating the condition may be. Fortunately, most people with fibromyalgia can improve by simple, yet effective strategies. In this presentation, we will look into how we can use lifestyle and other non-drug therapies to manage and treat fibromyalgia. 2 to 4% of the adult population suffer from fibromyalgia. The condition is usually invisible to others, but so limiting and troublesome for the person who suffers from it. The most common feature of fibromyalgia is chronic widespread pain. For some, even light touch is uncomfortable and painful. In addition to pain, most people with fibromyalgia suffer also from fatigue, problems with sleep, forgetfulness, reduced attention, and other cognitive symptoms. Abdominal symptoms such as irritable bowel syndrome and mental challenges such as depression and anxiety are also common features of this debilitating disease. The pain in fibromyalgia is mainly caused by changes in pain processing in the central nervous system, called central sensitization. Due to processes and mechanisms that we do not yet fully understand, there is increased processing of pain stimuli to the brain, while there is less physiological suppression of pain stimuli. In other words, a stronger gas pedal and weaker brake pedal. This may cause people to have hyperalgesia, that is increased pain response, or allodynia, that is pain just from light touch. The pain in fibromyalgia may be worsened by both internal and external factors, including stress and weather changes. When the weather is changing from high barometric pressure or sunny weather to low barometric pressure or rainy weather, the fibromyalgia pain can often worsen. Fibromyalgia is best treated with a broad approach where lifestyle and other non-drug therapies play an important role. Most people with fibromyalgia prefer non-drug therapies because the medications have limited effect and often unwanted side effects. For this reason, it is important to know how to apply lifestyle treatment and other non-drug therapies effectively. For the rest of the presentation, we will therefore explore what these treatments consist of and how to make the best use of them. Much can be done to improve fibromyalgia, and a broad or multimodal approach often gives the best result. The general treatment goals of fibromyalgia is to reduce pain, improve sleep, reduce and cope with stress, and improve and maintain functional ability, and for as many as possible also maintain and improve workability. This is often best achieved in a rehabilitation program extending over several weeks, where experienced doctors, physical therapists, psychologists, and other allied health professionals work together to help you reach these goals. Physical activity is the only treatment that has a strong recommendation, which is based on the strong evidence that regular physical activity can reduce symptoms of fibromyalgia. Physical activity has effect on many aspects of health and should be of particular interest to people with fibromyalgia. Regular physical activity tends to increase energy and quality of life, also for people with fibromyalgia if dosed properly. More on this later. Being physically active also improves aspects of well-being, including optimism, courage, sleep quality, stress, and also has a positive effect on mental health and cognitive function. In addition, there is evidence that physical activity may improve symptoms of irritable bowel syndrome. Thus, regular physical activity improves all of the common symptoms or aspects of fibromyalgia, including pain, fatigue, sleep problems, stress, cognitive function, and mental health issues, as well as abdominal symptoms. However, it is important not to overdo physical activity as it may increase symptoms, particularly if you suffer from fatigue. As mentioned, physical activity is the only treatment with a strong recommendation, and will over weeks and a few months reduce pain, stiffness and fatigue. However, pain may often increase in the beginning of an exercise program. Typically, will fibromyalgia patients at the rehabilitation center where I work have increased pain in the first week or weeks of their stay, but be patient, the symptoms will reduce after some time. One of the signs to be aware of is fatigue. If exercise increases your fatigue, particularly for several days after exercise, it is recommended to reduce the amount of physical activity. You may want to start with short, low-intensity exercise and gradually over weeks and months increase the frequency of training, length of each training session, and in the end also increase the intensity of physical activity. There is most evidence for endurance training, but resistance training has also shown positive effect on fibromyalgia symptoms. Swimming in a warm water pool is one of the best exercises for fibromyalgia. On the other hand, being completely inactive tends to increase pain and stiffness. In my 10 years of experience treating fibromyalgia, one of the biggest challenges a person with fibromyalgia-related fatigue has, is to accept and take into account the fatigue. The person will often try to just pull themselves together and hope that things will go well. However, this strategy tends to worsen the fatigue and other symptoms after a while. This is why pacing or activity management is so important part of managing fibromyalgia. In my experience, people with very heavy symptoms, particularly fatigue, do not balance activity and rest satisfactorily, or they may have ongoing exacerbating factors. More on this later. How we think about our health challenges may also influence fibromyalgia symptoms. Cognitive behavioral therapy has shown to reduce pain, improve mood and also quality of life among people with fibromyalgia. People with fibromyalgia often suffer from exacerbating factors including mental health issues, such as anxiety or depression. In addition, many experience a great amount of stress and sleep problems. Addressing these exacerbating issues may help reduce pain and fatigue. In addition, there may be additional causes of fatigue among people with fibromyalgia-related fatigue. Detecting and addressing possible deficiencies such as vitamin B12, vitamin D and iron deficiencies, or common fatigue-related conditions such as endocrine diseases may improve fatigue. Long-lasting stress, be it mental, physical or social stress, is often one of the factors that causes development of fibromyalgia. Fibromyalgia is further a condition where stress may aggravate symptoms to a larger extent than in other medical conditions. Of the common pain conditions, stress increases pain much more among people with fibromyalgia than, for example, people with rheumatoid arthritis. People react and tolerate stress differently. Hans Selye wrote that, "Stress is not only about what happens to the individual, but also how the individual reacts to stress. Some people have low tolerance to stress while other people have less bodily reaction to stress. To some extent, people can increase resilience to stress. There are many types of stress including social stress, emotional stress, job-related stress and physical stress. It is essential that we are aware of the stressor so that we may address stress effectively." We are probably all familiar with how stress may influence us. Stress often causes physical symptoms such as muscle tension and abdominal symptoms, as well as increased heart rate and blood pressure. Chronic stress may also increase mental symptoms including anxiety and depression, and even post-traumatic stress syndrome if the stress has been severe enough. Cognitive function also takes a toll, as brain functions such as memory and attention are reduced. Most visible to other people are behavioral effects of stress. We tend to be more easily irritated, frustrated, angry and impulsive, and also tend to adapt to a less healthy lifestyle under stress. So, how do we best manage stress? My suggestion is to address the cause as far as possible. There are many techniques that may reduce general stress, but they may not always address the underlying reason for us being stressed. Pacing is probably the most important stress-reducing tool if we constantly do more than what the body tolerates. If we tend to react with anger in traffic situations, it may be a good strategy to work with impulsivity and thought habits. Forgiveness is an effective treatment for stress due to bitterness. Social stressor, such as challenging family relationships, may be best dealt with through improving communication or setting limits. Financial stress does not away with deep breathing or yoga. Seek professional help, create a budget, and try to address the root cause of financial stress. In addition to addressing the cause of stress as much as possible, there are other things we can do to reduce stress symptoms and increase stress resilience. These are simple strategies such as taking good care of oneself with regular physical activity, preferably outdoors where we are exposed to daylight and nature. This also helps us to be more in the present, not living with worries for tomorrow and remorse for yesterday. Look at children and pets. They are experts at being in the present. Good social connections is vital for good mental health, as well as a healthy, balanced diet. Peace of mind, with a good conscience, and an outward focus is a stress reliever. Also try to include laughter, joy, and a bit of humor into life. Laughter has shown to reduce stress within minutes. Reduced sleep is a common problem in fibromyalgia. Sleep is important for physical and mental health as well as for optimal cognitive function. Studies have shown that people with fibromyalgia have reduced sleep quality and often feel unrefreshed when waking up in the morning, even if they slept through all the night. People with fibromyalgia also experience more frequent awakenings during night and spend more time awake in bed. One of the reasons for the above symptoms is that there is less of the deep restorative sleep phase in fibromyalgia. Deep sleep is vital particularly for physical restoration and for feeling refreshed when waking up in the morning. There are certain factors that influence deep sleep. Physical activity and also a hot bath before bedtime has shown to increase deep sleep. Opposite, caffeine, alcohol, and a too hot sleeping environment, and possibly also stress, has shown to reduce deep sleep. If your sleep is unrefreshed, you may try to adjust your lifestyle to a more deep sleep promoting lifestyle. As it goes for stress, so also for sleep issues. Try to address the cause of the sleep problem as far as possible. One of the most common causes of insomnia is mental health issues such as depression, anxiety, or stress. In addition, pain is often a factor that prevents people with fibromyalgia to have good sleep. The most effective general sleep therapy is cognitive behavioral therapy for insomnia, where one of the core components is sleep restriction therapy. It is a demanding but effective treatment, and the strategy aims to increase sleep pressure. If you sleep 5 hours a night, you will start the treatment by going to bed 5 hours before the time you get out of bed in the morning. For example, you go to bed at 2 a.m. if you plan to get out of bed at 7 a.m. When you sleep about 80 to 85% of the time you stay in bed, for a whole week, you go to bed 15 to 20 minutes earlier the next week. Slowly your body adapts and sleep more efficiently. As the weeks go by and the sleep improves, you go earlier to bed. This particular therapy has shown effects also in fibromyalgia with increased sleep quality, less pain, anxiety, and depression. In addition to the other sleep measures mentioned earlier, it is always important to take care of the circadian rhythm by getting up and going to bed at approximately the same time every day. Get some exposure to daylight, preferably early in the day, and avoid sleeping during the day. Towards bedtime, reduce activating activities such as drinking caffeinated beverages, intense exercise, and exposure to blue light. For some people, large meals close to bedtime may interfere with sleep. When it comes to nutrition and fibromyalgia, there is not yet enough evidence to make strong recommendations about specific foods or diet. The best evidence is for using a low FODMAP diet for treating irritable bowel syndrome, a common condition among people with fibromyalgia. The diet is not a diet per se, but consists of excluding certain foods that contain types of carbohydrates that tend to cause fermentation in the digestive system more easily. For other foods, nutrients and diets, there is mixed, weak or limited evidence. After following the science and research on lifestyle and fibromyalgia for a while, there seems to be some evidence that vitamin D deficiency may aggravate fibromyalgia symptoms and that vitamin D supplementation may improve symptoms. There is also some evidence that a plant-based diet may reduce fibromyalgia symptoms. In conclusion, fibromyalgia is a condition with altered pain processing, with additional symptoms, commonly fatigue, reduced sleep, brain fog, mental health challenges and abdominal symptoms. The best lifestyle and non-drug treatment strategies include regular physical activity, preferably gradual increase over time. Equally important, if suffering from fatigue, is to find a good balance between activity and rest. Doing more than the body tolerates will over time increase symptoms and make the condition worse. Manage and treat sleep difficulties, stress and mental health issues may cause people with fibromyalgia to have less pain and fatigue. When it comes to nutrition, aim for a balanced, generally healthy diet. In addition to lifestyle and other non-drug treatments, there are several medications that may help to reduce pain, sleep problems and other symptoms of fibromyalgia. Talk to your doctor if you do not experience satisfactory effect of the lifestyle and non-drug strategies presented here. Thank you for your attention. In the description area you will find more information, including links to relevant resources.